Of course, please like, subscribe, follow us on Facebook. And we're going to be talking today a little bit about a subject I think everyone's been experiencing for a little while here, and it's really anxiety and fear. But it goes beyond fear. Anxiety and fear are things that are healthy, especially at certain levels. But when we get past that area, that level of fear into phobias and irrational fears, that becomes a dangerous place, doesn't it, Doctor?
Absolutely, and welcome again. I think that it's kind of like an interesting time to be talking about irrational fears because we see a lot of that in our environment lately. But I think that irrational fear is one of those terms that it gets colloquial, that people tend to judge others in terms of their fears and judging them in terms of what is irrational and what is not. Right? Can you hold on just 1 second because I need to close the door. It's getting too noisy out there.
Of
Hold on.
course, of course. As the doctor closes his door, his points are there to hopefully get you to respond. So please, this is a live show. Go ahead and make some comments. So hopefully we can respond
I am
online.
back.
And here
Sorry
he is.
about
He is
that.
back.
Those things happen, and I don't want this recording to get too bad. Anyhow, I was trying to explain that irrationality is something that we have to be careful with because we're very quick to actually judge other people, right? In terms of you are being irrational. So we need to understand that in the context of psychiatry, irrational fear equals a phobia, meaning either a specific thing that you're so afraid of that your reaction to it is irrational. Let me give you an example. You're afraid of airplanes, right? And you don't want to get into an airplane because of the risk of having an accident. Now, logic tells us that the risk of getting an accident is extremely low, right? It's actually lower for dying in a in an airplane accident than dying in a car accident. However, but for the phobia to be an irrational thought, it cannot be changed by rationality, meaning you cannot walk somebody out of that idea. You cannot tell, well, but you know that the facts are this. They will say, yes, but I still can't, right?
So is it the feeling itself, or is it the behavior associated with that? I will never ever get in a plane. I will do everything to avoid it. Planes, trains, automobiles, but not planes itself. Is it the reaction that's really the issue, or is it the fear itself?
Well, it is the irrational fear that keeps you from taking the risk, right? For example, if you have phobias of elevators, right? And you always take the stairs, but now you broke a leg and you have to get an elevator if you're going to want to go to work. And the brain is telling you, no, you cannot go in there because it's too dangerous. It's like a disconnect of the measurement of danger, right? Your brain is actually telling you that the potential outcome from that risk is not worth you sacrificing your life for, right? Because the fear is that something catastrophic is going to happen, like you're going to die, right? So the irrationality comes from the fear first, right? So you really, when you have a phobia, you get exposed to the element that causes you the phobia, like having to walk in a high space, or getting into a small space, or going into an elevator, getting into an airplane. The reaction from the body is no different than the reaction we see with anxiety. Okay? What separates them from generalized anxiety is that there's a particular specific situation that is leading to that, right? Now, we have to understand that phobias are very common, right? And in some circumstances, they're easy to avoid, right? For example, if you are afraid of spiders, well, there are spiders, but not a lot of spiders, and you can pretty much live your life in a way that you try to avoid encounters with spiders, right? But if a spider comes up, you're going to get very anxious. You're going to get very nervous. You're going to be concerned that you may die. And that has become a huge issue, right? Lately, when we talk about vaccines, right?
Mm.
Because people have gotten a little confused between being logically afraid of a vaccine or having a phobia to the vaccine, right? And most people, I don't think, have necessarily a phobia to something they've never known before, right? There may be few people that are afraid of vaccines in general that will tell you, I will not get any vaccine because it causes me a panic attack. Just the idea of getting one, right? But then you start getting into the big question, which is, can you have irrational thoughts without having a phobia,
Mm.
right? And the answer is yes, right? But that is different than the way we looked at irrational thoughts in psychiatry in particular, because we connect irrational thoughts with phobia and anxiety, right?
So is it a psychological issue more than it is an actual brain chemistry issue? It's not a psychiatric problem per se. It's more of a psychological one. And what brings it on? Childhood trauma, experiences, just generalized, I guess, delusions about or a fantasy about something they've never experienced, or does there have to be a real life experience that's associated with that fear?
Well, it is complicated, and like everything in my business is complicated. I wish I could say, something blocked your appendix and it got inflamed and it's got to be removed, right? So that's appendicitis. It's not that simple because it's a confluence of different factors, right? So you have situations that lead to genetics, right? Phobias and anxiety run in families, and some people would say anywhere from a 20 to a 60% likelihood of inheriting a phobia or an anxiety disorder if somebody in your family had it. But we also know that experience molds the brain, right? So you growing up experiences are going to also determine memory for fear, right? We see that quite a bit in post-traumatic stress disorder, where there is a defect on the circular remembering of a memory that triggers a panic attack or that triggers a fear response because of prior experience, right? Not everybody gets that. Not everybody who goes into a battlefield and witnesses the same event develops PTSD, but some people do, right? And it's not that they're defective, it's that the brain is built differently, and that could be genetic. But the experience is required too, right? So in order for you to have a phobia of, I don't know, spiders, let's stay with the spider, right? You have to have experience and encounter with a spider, right? That triggers your normal mechanism of protection, but something goes array that now it becomes an excessive reaction. And that creates experience, reaction, memory, and then it gets repetitive. Every single time you have that, even the idea, not you don't have to have the exposure, just the idea, it gives you severe anxiety. So there's a biological component, there's a psychological component, there's a social component. And then we have simple phobias and we have complex phobias, right? The most common, probably complex phobia will be social anxiety. You're afraid of social interaction. So that implies very complex processes. Or the agoraphobia that you develop when you have a panic attack and you keep getting panic attacks, and that you start being afraid irrationally of leaving your house because you want to be rescued in case you have another panic attack. And I've seen people move close to an emergency room because they feel so afraid of having another panic attack that they want to leave their house and they want to be rescued quickly, right? So this irrational thinking and phobias in particular are not severely disabling, People can learn to live their lives around that. I have a patient that actually cannot drive in the freeway, right? Just cannot drive in the freeway. And he lives in East Mesa and he works in downtown Phoenix, right?
Heck of a commute then, I'm sure.
And he drives to the surface streets, not the freeways, to work every day.
Hmm.
Actually, for him, COVID was a great thing because he got to stay at home and not
There you
having to
go.
go to work, right? And so use the idea, and I've had these conversations with this patient, just the idea of getting on the freeway causes him kind of a panic
Hmm.
reaction, right? So those things are common and those things happen a lot. Hence, anxiety reactions and disorders tend to be the most common psychiatric disturbances, right? So common that sometimes we make them like normal, right? Now, we have to remember again, phobias and irrational thinking associated with anxiety is different than the irrational thoughts that come with other situations, right? You can have irrational thoughts in the non-psychiatric context if you're being irrational. The question there is who decides who's irrational?
Hmm. Yeah, exactly. That's a tough one.
Yes, because we have to be very careful as professionals on not making judgments outside of our realm, right? So we have to be very careful when we step into the social political arena in terms of discussing your thoughts are irrational, right? If you come to me and you tell me I'm afraid of getting the vaccine, right? But I don't know the facts, I can't say that you're being irrational, but I can say, well, let's talk about the facts, right? And after knowing the facts, you can make a more informed decision. So it's important to recognize what is the purpose of identifying somebody's irrationality, because quite often in our modern social media environment, we want to find irrationality to either make fun of it or criticize it or reject it, right? The problem is that that's very entertaining, but is not productive.
It's quite damaging, actually. It pushes the person even further down that road, especially now that they can access information that supports
Correct.
their level of rationality or irrationality, however it's saying.
Exactly. So our job, especially as clinicians, is to soothe, okay, people into auto regulation, so we can help people regulate their fears, regulate their emotions at a point that they can make more adaptive decisions, right? So part of the issue with vaccines in particular nowadays is really the issue of how the irrationality is clouding your ability to be adaptive, right? Because at the end of the day, everything we do, okay, whether we do it biologically, psychologically, or social, leads to our adaptiveness. How are we adapting to our environment and how we're surviving in it, right? So we have to be able to understand and have facts so we can make more rational decisions that provide us with participation in the environment and safety, right? So what has happened with taking away the discussion of vaccines away from facts is that then you get into irrational thoughts and then you get into delusional thoughts. Delusional meaning that for most people, it will be excessively irrational, right? I mean, it's like somebody comes and tells you um, the vaccine that was built by the Russians was made by extraterrestrials, right? And extraterrestrials put some microchips that are going to inject on you so you can be tracked all through the universe, right? Okay. That sounds delusional to me, and I'm an expert in delusions, right? Now, what happens when you have 500,000 people believing that same thing?
Mm.
Is it still a delusion? Not according to the book, right? because it's enough people in that cult or culture that identifies by the same idea. And that's where we have still a lot of dilemma in psychiatry in terms of, can you have collective delusions
Hmm.
versus individual delusions? And in general in psychiatry, we don't get into collective too much. We get into individual, right? Now, based on my experience, I think that people can be collectively delusional. And I don't measure it not just based on the strangest of the thoughts. I measure it in the context of how much is that sacrificing their own survival? Because there's some basic, I don't know, reptilian processes that we have as humans that most other living things have that have to do with survival instinct, right? When your thinking gets to the point that is affecting or blocking your ability to exercise your survival instinct, there is a problem, right? And we see that in certain species, that they develop what is called learned helplessness,
Hmm.
right? Like you see in National Geographic, a zebra being eaten by a lion and still eating, right? That is a total sacrifice of survival instinct, and it happens after maybe running for a while, gives up. So imagine, let's move back into phobias, right? And you have water phobia. You can't get into water. Well, you can take showers, right? You have to figure out how you're going to have your hygiene. But let's say that you're in the woods next to a lake. Of course, you're not getting close to the lake. All of a sudden, you've been chased by a bear, and your only exit is to jump into the water. Would you jump in the water or not?
Hmm.
Okay, so your survival instinct should be strong enough that you do jump into the water, even if you have a panic attack. But some people would froze, right? They'll get frozen and won't move. They'll get killed by the bear. So there are a lot of concepts that we have to keep in mind that lead to people adaptiveness, right? I think that there's been a challenge to our ability to adapt because we've moved too fast from nature into big boxes in cities, right? So I think that we still have somewhat of a drive to explore and the ability to take risks and recognize and train our system, our brain, to recognize potential dangers and to give us options to how to deal with them. But I think the fact that we're in boxes makes it very difficult.
So how does a person who has a fear of something, again, agoraphobia, arachnophobia, whatever it may be, really gauge it if it's a true phobia versus just a fear? Where is that line? Is it again, that what you just mentioned, that if it precludes them from clicking into their natural survival instincts, but with a little spider in the corner, that may not push them that level. So how could an individual decide, do I need help? Is this a psychiatric issue or behavioral issue I need to pursue because it is negatively affecting my life versus something that just gives me the heebie-jeebies, for lack of a better term?
Well, I think that it really has a lot to do with your ability to function. You have to decide yourself, what is this doing to me? What is it doing to my life? We are adaptive mammals, right? We adapt to different circumstances and we learn. So if you have a specific phobia, it's kind of sometimes easy to move into a different circumstance. But again, if you're afraid of elevators again, and you break a leg and you can't get on the stairs anymore for the next 6 months because you had surgery and you want to go to work, well, you're going to have to figure that out, right? Because your coworkers are going to get tired of carrying you up, 3 flights of stairs after maybe 2 days, right? So you have to anticipate that some of those simple phobias are going to be problematic. So you have to identify, what is it? You always have to ask yourself, what is this doing to me? How is this affecting my ability to function? Because what we treat is not the disorder itself, but the consequence of, right? we're not that advanced neuropsychologically or neuropsychiatrically to pinpoint a specific areas of the brain that we can go and modify some cables and things are going to change. So all we have is medications that at best reduce some anxiety. Okay, and there's different classes of that. And then we have therapy that most of the time is exposure therapy, right? Exposure therapy would mean that you train someone to take the risk of confronting the fear. It's called exposure, right? So exposure is probably one of the best treatments for simple phobias. It gets a little more complicated, even though you can use exposure, but in these cases, I think medication is probably a little better than just psychotherapy. And it's when you get complex phobias, for example, social anxiety. I mean, antidepressants of the serotonin base, like Zoloft, Prozac, fluoxetine, are very effective on reducing the anxiety of risk taking socially, right? And we see that very early in life. We see a lot of kids with those problems. You have beta blockers or blood pressure medications that block the reaction of anxiety. So we have tools to give people, but in simple phobias, we normally start with exposure therapy, and the anxiety is too high, we may go to some medications to reduce the anxiety. But in general, it's a lot of work, right? So a lot of people, you have to have multiple sessions because first you have to, let me give you an example. You have to stand in front of the elevator, right? And you have to see the doors opening and the doors closing. And that's going to give you a lot of anxiety. Okay. And maybe you do that 2 or 3 times. The next time you get closer to the door of the elevator and you put one leg inside and then pull it out. You see, you're desensitizing the person to learn the experience of nothing happens. Right? Because in their head and in their emotions and their body reaction, they're experiencing a lot of anxiety, right? But it is possible to help with that.
It always seems to be the same 3 things that you mentioned: intensity, frequency, and how much dysfunction to decide the level of complexity to it. And then you just mentioned the treatment factors. There could be something treating the specific symptoms or the reactions of it, and then the actual behaviors.
Mm-hmm.
But you said something that piqued my interest. You said something about children.
Mm-hmm.
How does a parent who has a child who is deathly afraid of raccoons, yes, my stepdaughter, how do you determine from their behavior that is just a base fear or something that we can work with, or a true phobia that really needs professional help?
Well, the only way you can find out is exposing her to the raccoon, right? You're going to see the reaction when she's exposed to a raccoon that is going to be somewhat irrational, right? I mean, she's going to stand behind you, get on your back, keep that thing away from me. I mean, almost like having a panic attack. And she's going to have symptoms of anxiety, meaning palpitations in the heart. It's going to be sweating. It's going to be breathing real fast. It's actually a panic reaction, right?
Okay.
To that exposure. I mean,
so it's more than just crying, I don't like it. It really is a true physiological kind of fight or flight response.
Yes. I mean, it's that level of irrationality again, right? But not to be confused with the irrational thinking of somebody saying, I don't like to get into boats, right? Why? Because I get dizzy. Are you afraid of it? No, they're not. So it is something very similar that we use when we try to separate somebody who is worrying and is anxious and somebody who's agitated or restless, right? Because it may look very much the same. But the difference is that the person who's restless or who's agitated may not be worrying about anything. That's a physical, emotional evidence of agitation or restlessness. The person who's anxious may be restless, but they will tell you they can't stop worrying, right? So those are kind of easy ways to start understanding the differences and the details that we look into to separate this.
And if we have a person in our lives, and again, you said phobias are incredibly common. I'm sure there's quite a few people we'll be encountering in our day-to-day lives that have this. What's the appropriate response from us, from our side, for the person not experiencing the phobia and those fears?
Well, there are a couple of things. One is never embarrass them. Because if you recognize that somebody is panicking, you have to extend a hand and ask, how do I help you? Right? What can I do? Because sometimes things look so irrational that we start making fun of it, or we start criticizing and putting them down. That's what we should never do. We have to extend a hand. We have to listen, right? I mean, and maybe a stranger, you can tell someone, you look very scared. Is there anything I can do to help you? We extend the hand. We don't tell them, why are you yelling? Why are you being so irrational? I mean, how can you be so afraid of that little Chihuahua dog, which people should be afraid of them, but that's a separate issue.
That's true.
They're demons, so that's a separate issue. but again, when I was little, I had neighbors that had Chihuahuas, and I hated them. I mean, because they're so noisy, they always biting your ankles.
And they do bite more than most dogs. That is true.
So, but that's not a phobia, right? I wasn't afraid of them. I just did not figure out how to kick them. So that was a separate thing. But the reality is that when somebody experiencing a phobia and they're in the midst of an attack, phobia, because they're being exposed to something like that, they need a lot of space, understanding, and they need connection. Okay, that you are giving them an out. All right. And you can say, you're going to be safe, just move this way. Right. But you need to understand, we all have a phobia-like reaction under certain circumstances, right? If you're walking down one of the paths here in the mountains, and all of a sudden you find a snake in front of you that is ready to attack you, you better have a phobic reaction. You better have a panic reaction to protect yourself, right? The problem is some people will get frozen, okay? And they'll get bitten, right? So we have to recognize that a lot of our reactions, in exaggeration, we call them disorders, but they're normal reactions. We have to be able to recognize danger, and we have to be able to protect ourselves from that danger. People that have irrational fears or phobias tend to react excessively to a danger is not that big, right? And then you cannot convince them otherwise by rationality or by facts, right?
So to that point, we have quite a few people, and I know in one of the other worlds that I work in the security industry, just a tremendous amount of people showing up with trepidation about the social structure, what's going on, and desperately wanting to learn how to shoot firearms. I spend a majority of the class explaining that it's probably not going to ever be something they need, but allowing them to enjoy firearms for what they are. How do you, when you have a large group, so now we're not the individual, you kind of mentioned this earlier, we have a large group of people who are consistently believing or feeling something that really, again, statistically speaking, is never going to happen to them. What's the response there from individuals and society?
I think that we have to deliver the right message, and the right message is, we understand you're afraid, even though it's hard for you to say it. Okay. And you need to define the purpose of the tools you're going to utilize to decrease your fear. I don't think that people should own guns to feel less afraid.
I totally agree. It's pretty much
Okay.
what I preach the entire time.
Exactly. So you should own a gun because it's an art, it's a sport. It can be of protection if you know how to use it properly. But if you're afraid with a gun, you're a dangerous person.
Very.
Right? So we have to train and educate people that owning a gun to make you less afraid makes you more dangerous. Right?
And doesn't really change the fear, because you're still
Exactly.
afraid of whatever you're afraid of. Now you just
Yeah,
have an object that makes you feel a little more comfortable, but really it
exactly.
doesn't. It actually exacerbates that fear.
And you may pull that trigger because you're afraid, and you may be irrationally afraid, right? Or you may be the victim of the circumstances because things are happening too fast, and then you're afraid, you don't know what to do, and you pull the trigger, right? You didn't have time to not be afraid. So my advice is, if you're afraid, don't grab a gun.
Mm.
You know, go and talk to a therapist about how to feel comfortable with yourself, right? So you can be rational about your fears, and then you can use the proper technique. I mean, part of the problem, Vince, is that, and we talked about this before, we have made a big business out of fear, right?
Absolutely.
Fear sells better than hope. So if we scare people enough, they'll buy.
Absolutely.
And the elderly is the best example of that, right? We have convinced elderly people that they're in danger, even though statistically it doesn't show that, right? So what do? They buy things to feel safe. But if we don't make them scared, right? If we show them the correct statistics, and what is the likelihood of you being mugged, right? Then maybe they buy less.
Mm. Absolutely.
But in a society like ours, you know, we change presidents, people are afraid, they go and buy more guns. For what? Because it makes them feel more in control, makes them feel safer. But you should never, I mean, I'm going to repeat this, you should never grab a gun when you're afraid.
Absolutely.
Yeah. Hey, it was a great conversation, man. Thank you very
As
much.
always
Yeah.
wonderful. And everybody, please remember to like, share, and subscribe. We'll talk to you again next week.
Hey, thank you.
Take care.
Okay, man, we're done.